Dr. James Bogash, expert in health and longevity and creator of Bogash Life and Balance, as well as the author of Migraines and Epilepsies, How to Find Relief, Live Well, and Protect Your Brain. And today we're going to talk about SUDEP, or Sudden Unexplained or Unexpected Death in Epilepsy. And this is probably one of the, even though it's very low risk, it's one of the scariest things that a lot of epileptic or people with epilepsy are concerned about, because it seems to strike out of nowhere, and we've really identified a lot of the risk factors over the years looking at that, and probably highest on the list are the generalized tonic clonic seizures, especially happening at night, and the more that we have of those type of seizures, the worse, the higher the risk of SUDEP. But so the question is, how did this whole lockdown scenario play out in the risk factors for SUDEP? So not necessarily SUDEP, but the risk factors that will increase the risk of SUDEP, because we obviously want to keep those down and under control. But did they get out of control during the lockdown? And the answer with a lot of other health concerns is that, yeah, everything went to hell, and very few people took better care of themselves, and the seizure population, the epilepsy population was no different. So this was a study looking at 340 people with epilepsy in Cairo, Egypt, and they found that there were a number of things that actually increased their risk for SUDEP. Top of the list, or not top of the list, but increasing use of anxiety medication was it's a known risk factor for SUDEP. So clearly, stressing out more during the pandemic was not good for anybody, especially people whose brains were already sensitive to stress. So that increased 2.7, so it increased the risk for SUDEP 2.7 times. Non-compliance with medication, 3.5 times higher risk of, as far as risk factors for SUDEP. And so, like, that's a challenging one, because that's all completely internal, and your desires, it might have been lack of resources, it might have been lack of communication with providers, but clearly the number one problem in this study were people not taking their medication, and that was the greatest risk factor for people having epilepsy emergencies. So either status epilepticus or a definite increase in seizure risk that sent people to the hospital. Drug-resistant epileptics that were still on medication. So these were people that might have been waiting for surgery and that they were still on dual medication. This was the greatest risk factor, and it's probably arguable that these people that were waiting for surgery, whole nother topic altogether, but they were already at increased risk of SUDEP because their seizures were not well controlled, and drug-resistant epilepsy, or DRE, is not a good thing. It's unfortunately 30% of patients don't respond to medication, so it can potentially be a pretty big group. 16.6 times increased risk for people that remained on their two medications, which is a little certainly challenging. And then adding a third medication to people with drug-resistant epilepsy, which seems a little counterintuitive, like the drugs aren't working, so let's add another one. That also increased the risk factors for SUDEP. So, for me with epilepsy, the challenge is always we need to discuss brain health, and that's never a conversation. All we usually do is just keep piling on medications until the brain cells can't communicate with one another and the seizures calm down or go away, hopefully, and then we pat each other on the back and we say we did it, but nobody really fixed the underlying brain health issue, and that's always in continued frustration with mine, is that brain health is not a discussion. And it's one of the reasons why I wrote my book, is to cover everything we can do to heal our brain and live well. As always, I'll post a link to this particular study in the description. Make sure you like this video, share it with somebody who you think needs the information, and subscribe to the channel.